At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle live right now on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle, right here on WMAL 105.9 in the Washington metropolitan area. Got another program for you that's always interesting, but more important, applicable. One that, if you pay attention, you can limit a whole lot of pain and discomfort that you have been putting up with perhaps for way, way, way too long. What am I talking about? I'm talking about herniated discs, ruptured discs, stenotic discs, bulging discs, slip disc, all those things that are in between the two bones called your vertebrae, those little cushions, those little shock absorbers that allow you to bend, turn, twist, and come back to normal. Well, all of that's leading up to this coming Wednesday evening, the 18th of February. God, can you believe it? It's 18th of February. And we're going to be doing it at the Roselle Center in Fairfax, the Roselle Center for Healing. And Dr. Harlan Browning, obviously lovingly called the Professor, we will be tag teaming. Those of you who've heard Dr. Browning before know he's an amazing fountain of information. Very few that compare to him. I'm always humbled when I lecture with him because he's always throws things out there. I look at it and I say, where'd you come up with that? But anyway, that's for you. That's coming this Wednesday evening at 6 p.m. The sun is not going down so rapidly. You'll have a better opportunity to get there and get home afterwards. So please join us. All we ask you to do to make that happen is go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com, and register for the class. If you can't make it, then just let us know, like a day before if you can, so we can, call somebody up and say, hey, we've got a spot for you. Would you like to join us? Now, the other piece is many of you have asked me ongoingly, and I've told you about it the last few weeks, that where can I buy things if we're not patients of yours? The things that you recommend are hard to find. Well, if you go to rosellecare.com, ROSELLECARE.com, and you go to the toolbar, you're going to see Ageless Health Store. And click that, and you're going to go down, and there's a site there. And that site is going to take you into one of the best wholesalers, if you will, with the products that we actually embrace. There's a lot of good things there. But the first thing you're going to do is you're going to look at 4 products that are sitting there that people have asked me, how can they keep themselves stronger, ongoing basis? And I said, here they are. There's 4 products. I take these every day myself. My family takes them every day. And these are the ones that I recommend to my patients just to keep them in a good place. So go to those areas and order them. They'll ship them to you. Bypass us. And there's other products in there that you can take a look at. Let's get into the program. Okay. Let's talk about that ruptured, that slip disc, that herniation, the things that you need to do. So here's the deal. Most of your bulging discs are because you haven't done anything with your body in a long time. That strong abdominal muscle, tensile strength, butt muscles, back muscles, they're not so strong anymore. And they haven't been for a long time. And it started out with a little low back pain that you ignored. And you thought it would go away. So your doctor said, take this and you should be fine. So you took it, it blunted the pain down, but it didn't fix the problem. It continued to do it without as much irritation until now there's more irritation that you can possibly deal with. So you have to look at, is there a way that I can restore, fix, and so forth? Look, there's a way of fixing things. I'm going to tell you a little quick story. Many of us are the age group that you remember a guy by the name of Joe Montana. He was quarterback for the San Francisco 49ers for a lot of years. He was one of the best that ever played the game. And there was one game that he took a snap from center. He went to one side of the field and then pivoted and threw cross field. And he did it so fast like a top, he actually sheared his L5 disc and it protruded. And that's called a surgical emergency. There was no option. There's no conservative anything. He had to get it done. And it was done the right way. And he had a good rehab team with chiropractors and physical therapists afterwards and got him back. And he went on to play the game for a much longer period of time. So that's called a surgical emergency. Now, with a herniated disc, a slip disc, you can have all kinds of problems. The leg pains that we've been talking about, but you could also have problems with the colon. You can have problems, either constipation or diarrhea. You can have erectile dysfunction, guys. Ladies, you can have something called dyspareunia. That means difficult intercourse. It's painful because the tissue's not relaxing. You can have difficulty urinating and so forth from a disc that's not in the right position. But do you have to have surgery? Now, here's the problem with surgery. It doesn't last. 50% of all surgeries fail within that first year. 50%. That means the pain doesn't change, or it's modified minimally, or it gets worse. 100%, virtually close to it, about 90-some percent of all low back surgeries fail in less than 10 years. So you're hoping to get it one and done, but it doesn't, because there's other pieces of the puzzle that you have to take into consideration, and you're not willing to do it. So you got to make some lifestyle changes, right, to start with. So it's called, what am I doing now that I shouldn't be doing? It's called all the inflammatory garbage that you put in your system. You know, we've talked about it repetitively, the sugars, the sodas, the constant coffee, the black teas. I mean, you don't drink water, you know, sugar, sodas, coffee, black teas, fast foods, all the garbage out there, fried foods, alcohol, too much of it, you know, the GMO products and all that craziness you keep putting in your system. You got to stop it if you want the acidity, the inflammatory level goes down. Look, I've been in practice well over 4 decades, and the deal is I've seen so much of this. I had the privilege of treating the NFL for many, many years, and the WNBA and some of the top Olympian athletes, and they rupture discs too. They herniate discs too, because sometimes they're not quite as smart as they say they are and not as good as they are. They have natural ability, and that's that. But here's how we deal. We have to look at what can be done. Well, first of all, if you're living with a disc problem, it's not a matter of calling your physician to put you on more drugs or inject your spine with a Depo-Medrol injection. It's a matter of calling somebody who deals with it on an ongoing basis. We deal with spinal decompression, laser therapies. We do acupuncture. It's a combination treatment. And if you follow that in conjunction with dietary changes that are causing inflammatory acid, if you can modify that down, you can actually resolve and turn this silliness around. Here's something else I want you to remember. You know, all those sodas that you drink, you know, regardless of who it is, what manufacturer it is, it's called soda, and it's got the fuzz and the fizz and so forth. Well, that stuff is phosphoric acid. And it's so strong that if you can concentrate it, it'll put a hole in your table. So your body has to neutralize it. It has to do something to prevent it from eating a hole in you. So what is it? It has to get an alkaline substance. Alkalinity is the opposite end of acidity, and you want to get that thing into neutral. So 7 is neutral, by the way. If you ever did an oral test, an oral pH, acid-base level of your mouth, you want to be a 7.2, 7.3 is perfect. That would be great. But most of us are way under 7, and because of the stuff that we put in our body. But the body's got to neutralize it. It's got to help you out. Otherwise, it's going to eat you. So how does it prevent you from being eaten by this acid that you put in your system? Easy. It goes to an alkaline storage. What is that alkaline storage? That alkaline storage is the calcium that you store in your bones. Did you hear me? The calcium that you store in your bones. So the body's going to release that calcium to try to protect you. It goes in and it neutralizes, if you will, neutralizes that acid because of all the junk that you've been putting in your system. By the way, stress causes acid buildup as well. not only are you losing calcium from your bone, which is going to make you hurt even more, the hole that the nerve comes out of, called spinal canal, the intervertebral canal, that means in between two bones canal, nerve goes out of that canal, now is being narrowed, and you're going to hurt like crazy. And that's going to cause that pain to be always there, chronic, you put up with. But when you put up with chronic pain on an ongoing basis, even if you're dumbing it down with all the NSAIDs, non-steroidal anti-inflammatories, your Advil, your Motrin, things of that nature, even if you dumb it down, it's still doing the damage, slowly, insidiously, ongoingly, but it steals the ability for something called sulfite or sulfate element to heal the cartilage, to heal the disc. It competes with that receptor site. Interesting, right? So the thing that you think that's going to help you is not healing you. It's actually perpetuating destruction, but it's doing it at a level that you can't feel it. I don't know about you, not okay with me, not something that I want to experience. So there's other things that you can do. Now, if you want to drop the inflammatory level, I'll give you a little sneak preview. You use things like proteolytic enzymes and a substance called quercetin, which is a natural anti-inflammatory. And you're going to do it at relatively high levels. Now, proteolytic enzymes, as you heard me said before, if you paid attention, are things that are produced from pancreatic production, like bromelain and papain and amylase and so forth. They're scavengers. They'll clean up the debris. They break things down. And they do it on but you got to take a lot of it. And then you use quercetin. And by the way, you take it on an empty stomach, because otherwise it acts as a digestive enzyme. So then what you do, you take the quercetin in conjunction, 4, 5, 6, 7,000 milligrams a day for a short period of time. It's not going to hurt you, by the way. And you do it in conjunction, and pretty soon that inflammatory level begins to modify, providing that you also change the garbage that you constantly put in your system. Now, how many of you realize that you got a roundness around your waistline that is far bigger than even your chest? You should have a drop from your chest to your waistline minimally of about 6 to 8 inches, right? So if you got a 44-inch chest, that's the jacket size that you wear, your waist should be 35 or 36, maybe you can get away with 38 inches at the most. And those muscles around there should be nice and tight, preferably better than that, but about that level. And now you know that you got a little tensile strength. How many of you don't get up off your derriere? You get up in the morning, you wash your face, you brush your teeth, hopefully, and you sponge down, maybe you get a shower, and you go downstairs and you get up a cup of coffee, get a piece of toast, put a bunch of jam on it, loaded with what? Sugar. What's the bread? Nothing but carbohydrate, sugar, and you're out the door. You get in the car, you drive to the office, school, work, or wherever you're going, and you go in and you sit down. And you sit there in front of your computer and you're doing work. And the only time that you get up is to go get a cup of coffee, or you have to go to the bathroom. And then you work till noon. Then you go walk a few yards down the hallway, you get a little something to eat. And then you go back and you do the same thing. Then you get back in the car and you go home and you sit on your butt and you flick the remote control. Sound like you? Well, if you're doing that, your whole structural system is being destroyed. Your stress level from what you were doing during the day is eating you up. The inflammatory level goes through the ceiling. Even if you're on a walker, you're on a cane, get your butt up and go for a walk. No, you can't do 5 miles or 6 miles, but you can do 100 feet, right? You can do 100 feet often. Go up and back. That's 200 feet. In the house, help yourself. Force yourself up the stairs. Is it easy? Probably not. But start changing a few things and see over a period of time if it makes a difference. What's the other thing you should do? You pick up the phone and you call somebody like me. And by the way, this is how serious we are trying to help you. If you go to my website, you go to drtomroselle.com, or actually to the office website. This is the one you're going to find. Go to rosellecare.com. You go to the top of the website and you're going to see a 20-minute courtesy consultation with one of my great doctors in the office. These guys are brilliant. They're all involved in a specialty called applied kinesiology, and then we have diplomates in neurology. We have guys that are DCCN practitioners, traditional Chinese medicine, and so forth. But here's the deal. This is what will save your butt but talk to them. They're, you can no harm, no foul. You got nothing to lose. There's no obligation. It's free, called free, and see what they say to you. But join us on this coming Wednesday evening. You can actually meet Dr. Browning, and I get to say hey to you, but we'll give you information you can take home with you. There's no obligation. We're not going to chain you to the chair and force you to do anything, but we're going to give you so much information that you're actually going to be able to do something to help yourself. That's really what it's all about. It's a do-it-yourself program. You remember my book, Ageless Health? Health is a do-it-yourself program. That's the deal that I want you to embrace, realizing that you are the driver's seat. You are the one that can make the difference. Only you, nobody else. So you call an acupuncturist, you call a chiropractor. We got all those wrapped into one facility, by the way. And then, but you have to remember, if you truly have a ruptured disc, a slipped disc, a herniated disc, it's not a matter watching and see. Take these medications, and if they help you, they help you, or injecting it with a Depomedrol and steroid, that's what it is, or take these steroidal patterns, these dose packs. They give them out like candy, but they're destroying and making the joint even worse. But you need spinal decompression, you need laser therapy, you need acupuncture, you need nutritional protocols together at one time. There's things also called pulsar frequency units. These pulsar units, these that go into the disc, they actually neutralize and normalize the cellular expression so they can actually begin to heal at a much more rapid rate. Did you hear me? It actually will heal at but you can't do it by yourself. There's no standalone. And this is the thing that drives me wild with the medical community often, and even sometimes in the natural community. There is no one and done. It takes you. It takes you to be involved. It takes your willingness to be able to change things. So if you're willing to do that, if you're willing to be proactive, you're willing to take responsibility. There's a guy, a very dear friend of mine, started out as a patient some years ago, but we became very close because he's a very successful man. I love hanging out with successful people because they have an attitude that is just is unstoppable, particularly when they're in a range of having created monster companies and so forth. Well, this man told me one day, and when I was lecturing actually for his company, and I heard him say to a group of people, he said, here's the solution to anything. You are the cause and you are the solution. You are the solution. You're the one that let it get out of hand. You're the one that brought it into this platform, that low back, that herniation, that nonsense. Other than a traumatic accident where it was sheared, like Joe Montana that I told you in the beginning of the program, you're the problem. You're the issue. You're the one that caused the breakdown. So if that's the case, can't you be the fix? The short answer is yes, you can be the fix. Many of you know what happened to me about 6 years ago. And I wasn't supposed to walk again, let alone practice again, let alone do any of the things I love to do again. My noggin was shook, but I couldn't walk. I was in trouble. Long story. Come to the class on Wednesday night and I'll tell you about it. But here I am back working. I was on crutches. I didn't work actively for almost about 2 years. And I was in causing trouble and directing and giving advice and so forth. But I'm back, 100% back. How did I do it? I made a decision that I truly believed everything that I've been talking about for many years, that the body is completely and fully capable of resolving and fixing anything. And I did what I tell my patients to do. And I came back. I'm functional. I teach. I fly all over the world. I have the opportunity of putting my hands on very, very sick people and being able to turn them around, providing they are willing, if you will, to become a partner in their own health, because that's the key. You have to be willing to do what it takes to resolve and to fix things. There's a rule when it comes to structural conditions and virtually every other condition, but with structural problems, it's an 80-10-10 rule. And 80% of the people that do the work that I do can completely, fully resolve. 10%, and it's actually more like 15%, can get a whole lot better. And they may have some residual. Why don't they get 100%? Well, a couple reasons. One is generally the most thing. They don't fully commit to themselves and do what is necessary to get themselves back to where they need to get back. And then there's that 5+ percentage of people. What's the deal there? The deal there is that they either don't have enough time left on the planet, which is the rare case, to fully resolve something, and it can always be made better, or they just say, no, I'm not doing that. I'm not changing my life. I'd rather do all the things that I'm doing and take the medication and, live the unfortunate lifestyle that they have. Look, you are in control. You're the cause. You're the cure. It's ageless health. That's the way the body was designed. That's how your creator designed your body, to be able to repair, refix, and everything. So here's a story that came up actually this last week, and it seems to show up periodically. Those that know me, know that I'm Roman Catholic, and this woman came into the office, and she was getting on me about something that I said to her, and I said, the body's fully capable of healing itself. You can heal anything that goes on. She said, I thought you were a Christian. I said, I am a Christian. She said, how can you say that? Say what? That you can heal yourself, that you can help heal other people, that the body has an energetic platform and so forth. I looked at her and I said, I know you've read the Bible many, many times, and I know you take Bible classes, but let me ask you something. I said, didn't this guy by the name of Jesus of Nazareth, who became, the Christ, Jesus Christ, I said, didn't he say these things and greater shall you do? And she just looked at me. I said, I think I've read that multiple times. I said, why don't you believe him? She didn't say a word. I just left the conversation hang right where it is. So if we have the ability, if we were designed and created in a way that our body has the ability to fix and change virtually anything, why don't we take advantage of it? Why don't we step up? Why don't we move forward? Why don't we do the things that we were gifted with relative to the magnificent body that we have, instead of destroying it, polluting it, and degrading it to the place where it can't function anymore? Now, I'm not getting into a religious spin here. What I'm just saying to you is that the energy that is in your body has the capacity for balancing itself and resolving itself 100%. So if that's the deal, why aren't you 100% in? Why aren't you willing to respect that carcass called your body, the human condition, and do what it takes? Why is it that there's some 100-year-old people out of there, and more of them, 105, 106, I saw one the other day, that was out dancing and doing swing? Why can they do it and we decide that we're going down the tubes? I don't know, but I can't dance anyway, but that's beside the point. But I can do other things. And I continue to want to do them and get better at them. Why won't you? Join me this coming Wednesday evening, the 18th, with the professor, Dr. Harlan Browning. And we're going to show you how. We're going to show you how to get rid of that disc pain. We're going to show you how to get rid of that leg pain, that neuropathy, that numbness, that tingling, and what you can do to help yourself. If you walk away with a handful of stuff that you're willing to do, and that's the last time we ever see you, I promise you this, you're going to feel better. You're going to have a better life. You're going to get your act together. And if I can crack that shell of you just a little bit, and you're willing to do something a little different, wow. What are the possibilities beyond that? Let's check it out. Let's see. You can fix ruptured disc, unless it's a surgical emergency, it has to be done like yesterday. You can restore your life. You can get function back. You can get things back to where you want them to be, so you can smile again on an ongoing basis. Join me this coming Wednesday night. Give us a call. We're coming to the end of the program. Remember, I'm here every Sunday at the same old time, high noon, in the Washington metro area, because the information is important, but more importantly, more than anything else, I love you all. You have a great day. We'll see you Wednesday night. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.